Whitney Houston with the greatest love of all, right here, Mo Akhanang FM. It is 20 minutes after the hour of 11 o'clock, right here, Mo Akhanang FM. Itsoseng is the name of the show as we are into Women Health Wednesday. We'll be looking at each and every Wednesday right here, Mo You can introduce yourself to the listeners by Akhanang FM. Which I was sent all of your titles and I was like, okay. As he explains himself, right? Because we can just say, doctor. But doctor per se, right? So introduce yourself.
All right. Dumelamba Maledi. My name is A.Matube. I'm a grade 1 MO or medical officer in Motingwe Hospital, based in the Department of Obstetrics and Gynecology. Thank you so much.
Yeah, I must do the introductions, right? So, right here, Itsoseng, and thank you for joining us today.
Thank you so much.
Thank you. All right, so let us get into it. So, cervical cancer, right? So now, cervical cancer, I feel like cervical cancer, a lot of people know what cervical cancer is, right? But now when we bring in HPV into it, we're like, okay, so now what is this? Are they similar? What is going on? So you can break it down for us as to what is cervical cancer and how is it related to HPV?
Okay, so HPV, it stands for human papillomavirus. It's a virus that is normally transmitted sexually, and it's actually the virus that leads to cervical cancer. So that's the relationship between the two. So cervical cancer, so the cervix, it's a mouth of the womb, that normally the virus itself actually, when you're having sexual intercourse, that virus will actually introduce itself to that area of the cervix, which is the mouth of the womb, and then it will cause some changes. So after it causes those changes, then it can actually turn into cancer. Hence we advise people to do pap smears.
So now, how common is HPV among women, and what are some of the risk factors for it developing into cervical cancer?
Can you please repeat the question?
How common is HPV among women?
So HPV is very, very common. It's one of them frequently sexually transmitted, and the other problem with it is that it's a skin-to-skin transmission. So even if you're using a condom, you can actually still get it. So condom doesn't 100% protect a person.
It doesn't protect other parts.
Yes. So it is very common. I don't know the statistics very well, but I know that in South Africa we have more than 3 times the incidence as compared to global population. So we're talking about, if we're taking 100 women, we'll have at least about 40 to 50 that are having this HPV virus. Yeah, but that doesn't mean it will always lead to cervical cancer. It can lead to genital warts, and sometimes people with oral cancers, again, oral sexual practices, it can cause the infection to go to the throat as well. Yeah.
You know, when I was doing a bit of a background with regards to this, and I saw pictures and I was like, this is an image I can't unsee it.
Yeah.
Right? When looking at that, you're like, okay, you know, this is what happens when you have HPV or those warts when they are. Yeah. All I can say is that if you want to see an image that cannot be erased from your mind, go and search HPV and look at images of that.
It is a very touching topic, and also seeing people suffering from it. I usually sometimes show some of my patients actually the pictures so that they can get a clearer idea of actually why is it important to prevent this, and also to practice responsible sexual activities. I would say sex cure patients. So that's another problem with HPV linked to HIV now, and both of them are sexually transmitted. So if you stay away from sex itself, you're saving yourself from two bigger killers in South Africa.
So now, what are the symptoms of cervical cancer, and at what stage do women normally notice them?
Unfortunately, HPV itself, it's usually a silent disease itself.
Okay.
And the body usually can actually get rid of it if you are not HIV positive or immunosuppressed. However, can be discharges, yellowish discharges, and it can also be normally there's no symptoms, honestly speaking. So maybe just itchiness in the vagina. It can be an indicator, but not really a symptom of cervical cancer. It can be just any general infection or STI.
So normally when you do get those symptoms, it has passed that later stage where now you need to go and see a doctor.
Definitely, especially with the cervical cancer. Remember that HPV has different classifications, right? So we do have those ones that we call high risk. So the high risk HPVs, it's 16, 18, 45, but they are like 31, 33, and 52 and 55. So those ones are the ones that we normally actually focus on because they are known to cause cervical cancer. But we do have 6 and 8 and the others that usually causes vaginal warts. So when we tried to tackle the HPV itself, we now at least are privileged to test, to have a screening tool for testing DNA of the HPV so that we can know which strain we are actually dealing with. And then that kind of like helps us to know which treatment or which protocol to follow.
To take. Okay. So now when we talk about cervical cancer, we have pap smear, that is related to it. So at what age should women do it?
Okay, so we as South Africans, we decided to actually go with a World Health Organization strategy.
Okay.
So if you are HIV negative, you start doing your pap smear at 25 years of age. No, at 30 years of age. And if you are HIV positive, and at 25 years. But however, because of the difficulties that we see, we have our strategy of prevention is still quite poor in South Africa. So
be on the safe side and be on the clear to know, do you have HPV, do you have cervical cancer, or anything related to that area?
I remember that also I said that with HIV, it becomes a problem. And if you can check now, the adolescent stage that we are facing now is those ones that were born with HIV. So they will be transmitting it, and we do see a high incidence of HIV in the adolescent age, like between 15 and 25. So why not take the advantage there so that you can catch it earlier? We do see some patients that still come to us with cancer itself earlier than 20 years. So that's why we're saying let's take opportunity to do pap smears even earlier than 25 years.
All right. It is now 31 after 11 o'clock, and you are still listening to Itsoseng. And we have Dr. A.Matube right here. And we're talking about cervical cancer and HPV. So at least, I'm trying to keep you up to speed if you just tuning in right now. So I believe that a lot of diseases or illnesses out there, they have vaccines.
Yes.
Right? So does HPV have a vaccine?
Yes, fortunate enough, it does have a vaccine. So 2014, South Africa decided to start a vaccination into schools. So we normally targeting kids that haven't started being sexually active. So we target an age group of 9 to 15 years of age. And we have a vaccine that we call Cervarix. There are 3 types that are now established in the world. So there's Cervarix, there's a Gardasil, and Gardasil 9. So the South African government is actually providing only for girls at the moment between 9 and 15, and then it's covering the 2 subtypes of HPV. So HPV 16 and 18, which are the ones that causes cervical cancer. More than 60% of cervical cancers are caused by 16 and 18 genotypes of HPV. So we're covering the young girls. It's between that age, and it's actually 2 doses, 6 months apart. So we will give them first dose usually around this time, and then also around November, December. Yeah.
So now, for women that have tested positive for HPV, what now is the next step? What do they do?
All right, so what we normally do with HPV, now we have what we call a liquid-based cytology. So liquid-based cytology is not a pap smear, it's a cytology. We put it just a speculum. Speculum is that instruments that we put inside the vagina in order to expose the cervix, meaning the mouth of the womb. And we just use a small brush just to turn it 1, 2, 3, and then we take it for study. So in our lab form, what we do is that we do a cytology, and we also do HPV DNA testing. So HPV DNA testing, you remember I said there are subtypes. So we divide them into 2 groups. The first group is a high risk group, the ones that is known to cause cervical cancer. So that will be 16, 18, and 45. And once we catch that on our results, then we go straight to treating. So there are 2 different strategies. The strategy that we use is that screen and treat, and there's screen, test, and treat. So the screen and treat, I don't want to confuse people with this lots of terminologies.
Okay.
But yeah, if ever we get high risk HPV, we go straight to treating this patient. So the treatment could be doing the LEDs. It's just a mini procedure that we do. It's an operation. We just take a piece of the mouth of the womb out, and then we take it to the lab to study it further. And then, but also it's meant to actually get rid of that part where the cervical cancer usually stand. Yeah. And then if you get the lower risk HPV strain, so we move to the cervical changes that this HPV causes. So there's low risk, and there's also a high risk. So if it's a low risk, we can say you can repeat the pap smear after a year. If it's a high risk, then there's this thing that we call colposcopy. So the colposcopy it's a camera that we use. It's a special camera that we use to look at which part of the cervix is affected, and we take a biopsy out of it, and we go to study it further. Yeah, based on those results, then we will treat it accordingly.
Is it not painful? You get a bit of, anesthesia, at least, so that it is not painful.
To kill the pain that comes to the cervix. And yeah, it's just it's not a very sophisticated operation. Okay. It's just there's something that bends, and then it bends and cuts at the same time. You understand? So we just bend and cut that area. Yeah, it's like scooping it out, and it takes about 5 minutes. But with us here in Potchefstroom Hospital, we normally book the patient to do it in theater. Yeah, so in theater definitely you'll get anesthesia, that you are awake, but your lower part of the body doesn't feel pain.
Wow, I cannot imagine having all of that procedure done and you are wide awake.
Yeah.
Talking about bending and Yeah.
Well,
Yeah. No.
don't make it sound so scary. It's not that scary at all, honestly.
Okay. So now, we know that a lot of illnesses, they have, myths, misconceptions around them. What are some other statements you've come across with regards to HPV or cervical cancer?
I think the first thing is about the vaccination itself. People have a negative reaction towards vaccination. So they don't believe in vaccination, some people, and vaccination really helps. It's our primary prevention actually of this virus. So that's the first one. And the second one is that people are not aware that cervical cancer is a preventable disease and it's also sexually transmitted. So usually I go to primary schools and high schools around Klekstop where I grew up. And what I found out is that when I speak about sexually transmitted part of this disease, people then start brightening up and they are not aware of
cervical cancer. And I think we touched a bit of it when you were starting with the conversation, but just to highlight it again.
Okay, so cervical cancer is caused by
Go. What advice would you have to?
It's best to be responsible for your own life, especially when we said this this virus itself. If we catch it early, there's actually a lot that we can do ourselves. So an advice that I will say is that if you haven't done a pap smear, you can just go do a pap smear. At least a pap smear, it's easy and it's not a painful procedure at all. It can be uncomfortable because definitely it's a very sensitive and private part area. But most of the time in the clinics it's sisters that are doing it. So at least female to female, it will be much more easier for you to do it. Yes, so I would say the advice is make sure that if you are sexually active, just make sure that at least you go do a pap smear. Yeah.
All right. Now, thank you for coming in and joining us today. We thank you very, very much and appreciate the information that you have given us, shedding a light onto this topic that we were talking about today. So thank you so much, Dr. A.Matube.
Thank you so much. You're welcome.
Thank you. We're going to continue on Nalwena with this hour. Right? We are 19 minutes to the hour of 12 o'clock.